I would like to call this meeting to order. It is 3 p.m. There is a quorum of 5 board members present. Leanne is excused due to a schedule conflict, and Marilyn is also excused. I would like to introduce our guests, or let's have, who's going to introduce the guests there, Tim?
Effie.
Okay,
Effie.
good job.
Hello, I am happy to share. It's that time of year where we get to celebrate the selections that we have from the region for Teacher of the Year and Classified School Employee of the Year. And in previous years, they were done at different times in the year. They would do the classified in the fall and the teacher in the spring. This past year, the state shifted it based on everything that was happening with the pandemic to doing both in the spring. And so we did all the outreach for the applicants, and then we screened the applications that came in, and then we narrowed them down to interviews. And then based on our interviews and applications and rubrics and all of that, we were really excited about having here. I'm going to start with the Teacher of the Year, and then I will let her say a few words, and then I'll jump to the classified. So our Teacher of the Year that we selected is from Washougal School District and Washougal High School, and it's Chef Brenda Hitchens. And I actually got to take the plaque out to her and run it out and get to see her classroom in action about a month or so ago. And the engagement level and the interaction and the conversations the kids were having with each other, and the enthusiasm around what they were doing and using problem solving is really exciting to see. So she's a CTE teacher, so career and technical education, and we're really excited. So welcome and congratulations, Brenda. She's our Regional Teacher of the Year.
Thank you. Can you hear me?
Yeah.
Oh, good. Because this speaker thing, I don't know. I wrote a couple things I was just going to read. Hopefully that's okay. Being nominated and then selected as ESD 112 Teacher of the Year for 2022 has taken me on many journeys that I am grateful for. Stretching my thinking when writing the essays for the application. I remember when the superintendent said, "Thank you for accepting the award." And I really didn't understand what she was meaning, but the application until I started writing about all these essays. And thankfully, I was surrounded by many, many good writers that were able to capture my feelings and put them into words that made some sense. I never thought in a million years that I would win this award, where I work with so many great teachers. And I just wish that all teachers had the opportunity to get this award. Hillary Seidel kind of stated to me as I'm trying to think about what to write from seed to apple. She said, "Your story has a power to shine a spotlight on the asset that industry trained teachers bring to our system, and also show what an impact relevant and applied learning can make on our students and community." And so my big question is, how can we get more industry professionals to become CTE teachers? We not just get teachers certified to teach these classes, but get professionals to really come in that possess not only the knowledge, but the technical skill. And that's going to be one of my goals as this award, if I can really bring that to the forefront. Then we went away for a retreat, and I was surrounded by so many great people, and I picked the winner because I really truly believe that Jared has a message that really needs to get out there. There's funding that needs to get to the Native American students that are not available because of some technicalities. And, you know, these kids, they're shame-based, and I don't want them to feel shame. So learning about that culture was important to me, and I really want him to succeed in bringing that forward and getting the funds that they need. We took away the land We took away a lot. I just really would like them to have it back and for them to really, I want to learn so much from them. So moving forward, my goal is to learn more, share more, teach more. And I just want to thank everybody who participated in this. And then working with Nancy and learning her story. And she's just a bubbly person, and I really enjoyed getting to know her as well. So thank you. And I hope that I'm here for you. If there's things that need to be done, please don't hesitate to reach out.
Congratulations, Chef.
Thank you.
Yes, congratulations.
Thank you.
And I do plan, as our kind of weeks progress and we are able to get out to buildings a bit more, bring Vicki Herdina, that is so focused on the career technical training of teachers and students, to bring her out to the classroom to meet and see her classroom too.
That's great, Effie. That's a good move.
Yeah, thank you. And then Jared, that she mentioned, he was selected as the state teacher of the year. So just put a little context there. And yeah, so great. Thank you and congratulations.
Thank you.
Are there any other questions for Brenda before I move on? No. Okay, so we're really
Just like the students.
if you have any questions, get them to Wendy and Wendy will get them to me.
Thank you.
Next we have Nancy Baldwin. She's the McKinney-Vento liaison, so she supports families in need and students in need. So she's a family support specialist with the Kelso School District. And I remember very clearly interviewing Nancy, and Pranjali was with me on the interviews, and we just lit up after that interview and so excited to have met Nancy and heard about the work she did. And she went on to win the state award. And so she is representing the state of Washington as the classified employee of the year. So welcome, Nancy.
Thank you very much. I remember the interview as well, you and Pranjali. I really look forward to you guys coming and paying me a visit.
I want to.
And I want to thank everybody so much. I can't really follow a speech like Brenda's. Mine's a little more glitter and unicorns, I guess, but I was just so excited to be nominated, and I was anxious to write the essays because I love anytime I get the opportunity to share my students and family stories. As amazing as this honor is and this award is for me, and I truly am humbled by the response that I did get and I continue to receive from my district. I'm in the best district ever. This was my school, high school way back when. It was my kids. Getting this from Kelso and from ESD 112 means even more. And I feel like this recognition has allowed my students and their families to step into the arena with me and to celebrate. The light is now shining on McKinney-Vento, and so often it's a negative thing, and the kids don't want to, they don't want to be known as on the McKinney-Vento caseload, and kids that aren't McKinney-Vento don't even know what that means, but they do. And this light now shined in such a positive and warm way that I feel like they've got to step in and shine with me. They're so proud. And I feel like this award is for all of my students and all of their families. It's their strength and their perseverance that has allowed us to celebrate in one district. They're no longer separated as those are the McKinney-Vento kids. You know, these are the general population kids. We're now all one group, and it's been my pleasure to get this group of kids together. We do projects together. It isn't easy for them to feel like they belong. They always feel a little bit different. And when they finally will come to me and say, how do I get a Kelso High t-shirt? As silly as that may sound to somebody, that tells me that that we've got them now. They're one of us. And if you love where you are, if you love what you're doing, you're going to come back. You're going to do your best, and you're going to have positive memories. I thank every one of you for the vote, for the confidence. I feel like this recognition is for my program, and we now will soar. We now are getting calls and visits, and I'm just so honored. I will remain honored. I will work hard every day going forward for you and for my families to make certain that we all remain worthy of this. It's a huge honor, and I don't take it lightly. I will represent the state and my region and my district with pride. I have so much pride in my district and my region, and I will represent Washington with that pride. You will not be sorry that you chose me. Thank you very much.
Hey, Nancy, what happens at the state level? What are your responsibilities?
Well, I don't know. Hillary came and paid me a lengthy visit last week, and we began the nomination for national. Apparently, you automatically then are in the running for the national award.
Wow.
So we started that, but she said she would be contacting me the first or second day of January, and that she would start putting me out there. Tim, I don't really know what that means, but I'm willing to go out there. So she will have to be my guide, and I will follow her faithfully, because she will not lead me astray. So I think that it's a lot of out of town visits and speaking engagements. I'm really not sure, but I'm ready to embrace it.
Well, good luck. Go ahead, Dee. Sorry.
No, that's all right. I would just like to add, on behalf of the board of directors, and I'm sure everyone at the ESD, to Brenda and Nancy, our heartfelt thanks for all that you do. I know these awards mean something. They have heart attached. Mm-hmm. But they are in no way equal compensation for what it is, the difference that you make in the lives of students. So thank you, thank you, thank you. And you are both welcome to stay until the end of our board meeting, as challenging as that may be, or exciting, I should say. But before you leave, again, thank you both. Thank you, thank you.
Oh, you're welcome. It's my pleasure to serve this district in this region, for sure.
Hey, Dee, could I just add one thing? I had the opportunity to be part of the selection committee for the Teacher of the Year and the Classified Staff Member of the Year. And so I had a chance to read both of your essays and read what your colleagues and students said about you. And, you know, I've always said being in the education system, especially public education, it's the most noble profession in the world. And we talk about the why of it. You guys are involved in it for the right reasons, and you're having an impact on so many lives. And it just, you know, being able to read through those essays and just looking at the great things that you are doing, both of you, and so many other educators. But just congratulations to both of you.
Thank you.
Nancy, I do have one question. Did you get your plaque?
No.
Oh my goodness, Tim. Tim gave it to me, and I know it was brought up there today. My wife was gonna bring it up and make sure that she got it. So I'm sure you'll get it tomorrow.
Dawn Iverson just left here.
Oh, there it is, right there.
That's Brenda.
Yep.
That's Brenda's.
No, I didn't get mine yet.
Okay, you should have yours tomorrow. I know she brought it up there today.
Okay. I look forward
Coming
to
via
that.
Pony Express.
Yeah. I'll wait.
Congratulations.
Thank you.
Thank you.
This is a very fun project to work on, as you can see. It's a really, when Kathy offered me the opportunity to take on Teacher of the Year, Classified Year, and going through and reading all the letters and reading all the applications and scoring them. And you learn a lot about people. And it's really one thing to read a superintendent's letter or a coworker's letter, but like Mike said, when you read the letters from students, those are extremely powerful in what we, look at when we make our selection too. It's really incredible. So thank you to the board, and thank you, Chef Brenda and Nancy Baldwin, for being here. And I will be working with Pranjali and Vicky to set up some times to come out to see you both.
Good. I look forward to that.
Me too.
Thank you
Thanks,
also,
Effie.
Effie.
Yeah, thank you.
Okay, moving right along, we are going to address the consent agenda. I would like to call for a motion and second to approve the following consent agenda items. That would be minutes of the business meeting September 28, 2021, ESD personal activity October 21, ESD expenditure reports for September 2021, and early Head Start budget status expenditure reports for September 2021.
I'll
move.
to approve these. Okay, I'll second.
Okay, it's been moved and seconded to approve the consent agenda for basically September and early October business. Is there any debate? Any comment? All those in favor of the motion indicate by saying aye.
Aye.
Those opposed say no. The ayes have it and the motion is adopted. Mike, are you available then to report for the Early Head Start ECAP program monthly report in Jody's stead?
I am ready. I'm sure I will not be able to fill those big shoes, but I'll give it my best shot while she's relaxing on a beach in Maui. So you all should have received the report. I just want to point out a couple things. In September, on September 24th, the staff at our early learning centers had their in-service days, and they have 2 of those each year. I apologize for that dog. 2 in-service days, and they had their first one the 24th. Can I just go shut that door real quick?
Yeah, go ahead. It
Right.
worked.
Jeez. But you can see some of the comments that the staff had after the training. It was very valuable for them. And besides the professional learning that they do, they get a chance to network with their colleagues from the other centers. And so that was, I think, a great day, as you can tell from those comments. The other thing, I always love reading the success stories that Jody shares. And this one in particular, and it really shows the full impact that our early learning program has, not on just the students, but the families. And I'll let you go ahead and read it if you haven't yet, but not only did our ECAP program have a huge impact on the little guy that was enrolled who had been struggling previously. He had been part of a CPS case, but he had made major strides, major growth physically, emotionally, and academically. And because of staff support, the mom had the motivation to go back and get her GED. And so just really, I think that's quite a testament. And we see these stories that she shares all the time. It's not just the kids that are impacted, it's the families. So it's, yeah, it's very cool. And so you can see the enrollment, and just like everywhere else right now, we're having a hard time finding staff. We've got a waiting list to get into our programs, but we just cannot find enough staff. And it was just the opposite last year. We had enough staff, but we didn't have the students because of COVID. So we continue to work on trying to recruit. HR does a great job helping us, and our partnership with Self. But if you know anybody that is looking for a very rewarding job, challenging, but rewarding in other ways, send them our way, because we could sure use it. And Dee, I guess, do you have anything that you'd like to add?
No, policy council, which you will get the minutes and stuff for next time. We had several parents join us this time, so efforts are paying off to get parents to attend policy council. And I know the staff works very hard at trying to attract and keep, parents who wish to volunteer. And one of them even volunteered to be a voting member. So they're moving ahead.
Good. That's it, Dee.
Okay, we have the Open Doors program update. Kathy and Kevin.
Thank you, Dee. Good afternoon, everybody. It's my pleasure to introduce Kevin Johnson to you for those who have not met him yet before. He is our Director of School Programs. He runs programs we have for At Promise Youth, both in Cowlitz County and Clark County. He's been here for about 17 or 18 years. He's been here for a long time, supporting those youth and working within the Teaching and Learning Division. But one of the programs we thought he could highlight and talk a little bit about is his Open Doors program. So kind of how that's looked since, how it's kind of changed a little bit since 2020, what it's doing now, how it also kind of interacts with other programs here, and just kind of give you a general update to that program. So Kevin.
Good afternoon. So Tim asked me to kind of give a little bit of a recap from last year, particularly how our program has been impacted by COVID, and then how we've kind of started to come out of that, and where we're headed moving forward. In terms of impact, ours was not all that different from a lot of different school situations. Certainly for the staff, the very first thing was just trying to quickly figure out a way to transition to a more remote operation where we didn't have kids in the building. And actually, we were actually able to do that relatively quickly. I think the bigger adjustment was really on the part of the students, and the challenges, not for them to be remote, but to keep them engaged when they were remote. And that not only just for them to be motivated to be engaged, but also the level of access that they had to things that the program entails, that for a long time were being shut down. For example, any of the kids that were trying to earn a GED during that first, really probably almost 8 to 10 months of COVID, really had no opportunity to engage in any testing. All the testing centers were closed, and took Pearson and the powers that be that actually monitor the GED testing time to figure out how to allow kids to do that remotely in a secure fashion. So certainly that was a challenge. And then as they couldn't test, or they were waiting to test, again, the motivation for them to remain engaged waned. So I think those were probably the biggest challenges that we had. As we moved farther into that, we were really almost entirely without students face-to-face for really about a year. I mean, it started roughly mid-March, and then that went all the way through until almost, for us, spring break of last year is when we actually started bringing kids back. And even then, that was done really more on an appointment basis. So it's not as though kids could just come access whenever they wanted to. We limited the number of students that could be in facilities at a given time. So it kind of made it more like a scheduled appointment, if you will. And so that was definitely better than fully remote. We were at that time partnered with the Next operation, which is a facility across town that's kind of a multi-agency community approach to At Promise Youth. And so we were actually running our operation before the pandemic out of that facility. We ran into the situation where we had no access to that facility throughout that time. So when we brought kids back, we actually just worked with our HR department and with Sparrow and with some other programs here that we figured out a way to provide space within our facility so we could actually see some students face to face. So through that, what we actually realized is that we actually wanted to make some changes there in terms of how we were partnered with Next. We're primarily allied with them through Workforce Investment Act interactions, Title I type programs. And so we really kind of took the approach, hey, we can still do all of that, but also provide that same service on our campus and really utilize some of the existing programs and the capacity of our own organization better to staff share and to also, just interact with other programs a bit. And so we're engaged really in being able to provide now through our school improvement grant here on our facility with utilizing staff from other programs, SPED. So we're providing, we have a 0.2 FTE SPED teacher now for Open Doors that is on site for us at those scheduled times. And we also have some mental health supports that we've been able to finance through our school improvement grant, which we've had now for 2 years. Fortunately, the state has amped the money on that up a little bit, and we're hoping we've just submitted our app to get that again for next year as well. So hopefully that'll be a continuing thing that is good for us. In terms of where we are with the program heading forward, even though, theoretically everybody is back to in-person school, I would say, practically we're more of what I would describe as a hybrid program right now, and, in de facto reality. OSPI extended the compliance rules for the Open Doors program, which is not a seat time program. It's a compliance program. So kids could get through a course at their own pace on ours relative to, they don't have to go sit in a seat for 180 days for X amount of time to complete the coursework. So what we have found is that a lot of the students after a year and a half of being remote, don't want to come back to in-person. And though we also have found that that's not usually in their best interest because they don't make as much progress, we are, trying to figure out ways where we can still meet them in a way where they're willing to engage and get them, on site face-to-face as much as we can. A lot of those rules, what they've changed is what they consider to be in-person or face-to-face communications and interactions. They put in emergency rules for COVID, and so they have extended those rules for at least the balance of this school year. So, for example, what we're doing right now would count as face-to-face interaction, whereas in the past that would not be the case. Phone calls, any sort of two-way immediate transactional communication. So email would not work, but text messaging, those kinds of things, which we have a student database piece that we can do it through that. So people aren't using their private phones, but those allow us more flexibility to be able to sort of meet that need of what would be a little bit more of a hybrid operation. So our enrollments for that program have probably dipped a good 15% since COVID, and it's been pretty steady from that point. We were at a point where we had about 160 kids engaged in that. Now we're down, more in the 100 to 120 range. We've started this year at 75, but typically the first 2 months of the school year, when you're dealing with at Promise Youth, are going to be lower enrollment months because they're actually engaged in regular ed school, and then they'll get sent to us if they're not doing as well. So we're sitting at a spot there where we don't have nearly the traffic in our buildings that we did prior to COVID, but we do have relatively similar and stable student enrollment pieces that we've moved through. So that's on the Open Door side. On the institution ed side, it's been a very different story. That one, the juvenile courts have really restricted how much they want access in a residential facility. So we've really seen the numbers in our juvenile detention or institution ed programs at like historic lows. And frankly, I don't see that changing anytime in the near future until we move past, probably fully out of the pandemic, largely because those are residential facilities. And so they just take a much more strict protocol viewpoint in terms of who they want in the facility, how many they'll allow in there at a time, et cetera. So on that one, we're really in kind of a holding pattern. And I think the challenge for us again with Open Doors is how can we figure out the best way to go from an in-person program to a fully remote program to now maybe trying to figure out how can we turn that into a hybrid piece that at least meets the needs of what we have until the pandemic is actually behind us and not sort of in this kind of gray area where we exist right now. So that's a mouthful, I realize, but I don't know if anybody's got questions, feel free to fire away.
Thank you, Kevin. Are there questions or input? I for one would like to, how do you see enrollment changing in the coming months as the pandemic either rises or falls? What do you see coming down?
I don't see things changing a lot this year, to be honest with you. And part of that, I think, again, is, we dealt with this just the other day in one of our facilities where you have a positive test and now you have close contact and now you have kids that have to quarantine for certain periods of time. So I just think getting students engaged where they're in-house is going to be relatively static. We're right now, again, we're at between 75 and 100 students in Open Doors. I would expect that number has been relatively static really for the past year, even though the pandemic has been a year and a half. That's been pretty consistent. It's really been more, were they in-house, were they remote, or were they hybrid? And that's kind of where we are there. I think the institution ed numbers will be extremely low for the foreseeable future.
Okay, thank you so very much, Kevin, especially for all the hard work you do. We'd like to move on to the vaccine mandate update. Marnie, are you available?
I am. Hi, everyone. Good to see you all. Tim had asked me just to share with the board kind of our process as October 18th. Last Monday was the deadline for confirming that all of our employees were fully vaccinated or had an accommodation. So we thought we'd share with you how.
Marty, can you turn your volume up a little bit, please?
I sure can try. Let me see. Let me try speaking to the computer instead and see if that's better. Just a minute. Can you hear me better now?
Yes.
Yeah.
Okay. We also just yesterday needed to file a report. Our ESD, all other ESDs and all school districts had to file a report with OSPI with the details around how all of us did complying with the vaccine mandate. For ESD 112, the information we shared with OSPI and our status with the vaccine mandate, we had 644 employees back on October 19th, the day after he had to be compliant. 558, so that's about 91%, are fully vaccinated. 215 of those 558 are assigned to work at the Vancouver campus. That number includes bus drivers, CSG, but also everyone working in this main building. So 215 out of our 558 were assigned to work here. The other 314 are working in schools or in positions in the field, like our prevention, intervention, early intervention, childcare aware. We have a whole bunch of people working out in the field as well. So 215 fully vaccinated here, 314 out in the field. We had 78, so 78 out of 558 that requested and received an accommodation. So the two grounds that a person can apply for and receive an accommodation. One is a medical condition. So employees that had medical conditions that prevented them from getting the vaccine, that required a signed document from a healthcare provider with information about their medical condition. We had, of those 78, 14 had medical conditions that interfered with getting the vaccine. That means the other 64 fell within the other category for getting an accommodation, and that is a religious belief. Tim thought it might be interesting to share with you kind of the general breakdown or where we saw a lot of our employees that requested accommodations. And first and foremost, we told all of our employees, and everyone on the screen can attest, we did not share the details of our employees' requests, the reasons why they applied for an accommodation, because that's confidential information. Their medical details and their religious beliefs are confidential. But the fact that they got an accommodation and then the measures they have to follow, that's the information that was shared. So we've really worked hard to protect the confidentiality of our employees who shared information that's personal to them. Having said that, I can share the general information for the 78 that got an accommodation. 15 out of the 215 working in the Vancouver campus got an accommodation. So we had about 15. That includes bus drivers and others, but 15 in the main campus. We had, actually that 15 in the main campus doesn't include bus drivers, because we had 13 bus drivers that received reasonable accommodations, and we have a total of 65 bus drivers. So 13 out of 65 of our bus drivers have accommodations. We had 15 teachers, so special ed teachers working out in our districts that received accommodations. We have a total of 88 teachers, so 15 out of 88. And then we had 15 paraeducators that requested and received an accommodation. We have about 120 paras working out in the schools. So that gives you maybe a general picture of where our employees who are not vaccinated, the kinds of positions that they have. Included in the 644 employees, there were fully vaccinated, the accommodations, and then we had to share information about employees who are no longer working with us because of the vaccine mandate. So we had 8 employees who are no longer here. 6 of them resigned. They told us, we had others that resigned that may or may not have been as a result of the vaccine. They didn't share that. They would just say personal reasons, or maybe they retired early. But we had 6 employees that specifically told us they were resigning because of the vaccine mandate. So they weren't going to get vaccinated, and they didn't have a medical or religious belief, so they resigned. We had 2 employees, they're classified employees. One was a special education nurse serving a one-on-one fragile student. Another one was a special education para who refused to get the vaccine and said they would not comply with any of the safety measures that are required of unvaccinated employees. So 2 people refused to comply. We went through quite a long process with them, tried to work with them and give them opportunities to comply. They wouldn't, so we terminated their employment on the 19th. The accommodations, just as a reminder, I think maybe last month we talked about what the safety measures were that were required for employees who got an accommodation, but there are 3 primary ones. All of these were recommended by the health department, our local doctors, who said to us, if you approve someone to work unvaccinated because they have a religious belief or medical condition, this is what we recommend to prevent the spread of COVID when they're working in person. So the first one was wearing a KN95 mask at all times. So that includes for employees who are unvaccinated when they're taking drinks, taking mask breaks, eating meals. They were told that anytime they took their KN95 mask off, they needed to do that when no one was around. We encouraged them to go outside, do other things. That's uncomfortable for us and them. It kind of feels like we're ostracizing them, but really, because unvaccinated are so much more likely to contract COVID and then spread it, that was the standard that we talked to all of our staff about and required them to follow. The second one was weekly COVID tests. So I'll talk about that in just a minute, but all of our employees were told they needed to test weekly. The recommendation was twice a week. Of course, not all of our districts where our employees are working are doing testing or are doing it twice a week. So I'll come back to that in a second. The third accommodation that was required was strict adherence to 6 feet of physical distancing. So, you know, do not go closer than 6 feet to the individuals, especially the students that you're working with who are not vaccinated. Having said that, we did tell all of our special education staff that the health and safety of our students comes first. And obviously, if you're working one-on-one with a student who's a flight risk and they take off running, we expect you to stop them or to do other things to keep them safe. Don't adhere to 6 feet of physical distancing and let something really bad happen to a student. So those are the 3 measures that all of the employees that are working unvaccinated have been told they need to comply with. And that's been in place for, this is week 2 now. The thing I thought might be interesting to let you know about is related to testing. So in conjunction with approving the accommodations, ESD 112 is screening our employees that work at Quest, Steps, drive a school bus, or work in this main campus that are not vaccinated. So we have set up and started operating last week COVID testing sites, the transportation center, at the Quest facility, at the Steps facility, and here at the main campus. We're doing antigen quick tests twice a week for all of our unvaccinated employees. We also are able and are doing at Steps, Quest, and this building, the PCR molecular tests. So the antigen quick test tells us if someone's positive. And today we tested a bus driver who drives out of Longview, had him go to the Steps building to get tested. They're unvaccinated, asymptomatic, feel fine, did the quick test, they're positive for COVID. So we had to call another bus driver, say this person can't drive, because you have sometimes you have no symptoms when you have COVID, but most people have a 48-hour window where they're contagious. And these quick tests can identify that they're contagious, but they don't have symptoms yet. So that is the purpose of doing the quick tests on unvaccinated employees. And, you know, it's hard when we call the transportation center and say your employee just tested positive, send another driver up here to drive the route this afternoon. She can't work now for 14 days or longer if she develops symptoms and isn't feeling better yet. So we'll have employees that are out, but we will hopefully prevent students on the bus or employees or students in classrooms from contracting COVID because these individuals have it. So that's the quick test. It's done on site within 15 minutes. I described it to all employees as being like a pregnancy test. If the color on the cotton swab changes and a line appears, you're positive, you go home. If not, then you're negative and you can work. When employees have symptoms, though, they have to do what's called a PCR molecular test because the antigen quick test has a lot of false negatives. It's really reliable for positives, but has a lot of false negatives. So if someone's symptomatic, in order to ensure that it's not COVID, the symptoms aren't COVID related, we do a PCR molecular test and that gets sent off to a lab and then we get the results back. So like, for example, last week in our general employee population, we had 9 employees who had COVID symptoms. We did PCR molecular tests on 6 of them at our ESD main campus. All 6 of them were negative. The results came back. So they must have had a cold or whatever it was, causing a headache or a cough or whatever their COVID symptom was. They were negative and that was good. They can now return to work if their symptoms have improved. But that's what we're doing now. So testing in 4 different sites. That's the breakdown of our employees who have accommodations. Any questions about any of that? Anything else you want me to touch on, Tim?
Marnie, I have one question. Are we covering the expense of this testing?
Yes, it's all provided by the State Department of Health through the Learn to Return program. So the tests and the labor, we've hired Karina McIntyre's back as our regional lead, not only overseeing and working with our site managers for testing, but with our school districts. So we do have funding from the state to pay some of the staff time, not all staff, like we have some ESD employees that are trained in doing testing as part of their other functions they've taken on, but we are getting funding from the state and the testing is all provided. Testing kits are provided by the state.
Question. Of the 78, 64 of those were accommodations. Were those all religious accommodations, or can you say? I don't know.
Those 64 were all religious. So every one of those employees filled out a document and described their religious beliefs and how that conflicted with getting the vaccine. A huge number of our employees' religious beliefs were related to their beliefs as they described it in Christianity, not believing in abortion, not agreeing to do or participate in anything that was any way linked to abortion, and the research and whatnot that was done for the COVID vaccines did use fetal cell lines. So that's a huge number of the religious accommodations that we saw.
Steve, I think that what maybe the direction you're going is like the state employees didn't really have that option.
Right.
School people report to another elected officials, Chris Reichdahl, then the governor. And he was a lot more lenient about allowing those.
Yeah, I think these sound like reasonable accommodations and not as difficult to get one, it sounds like, but the rest of the state's in kind of turmoil with all these lost police officers and firefighters. And
yeah, the governor's thing was more along the lines of, you're going to do this or not.
Yeah, that needs to be relooked at, I believe, because we're going to be faced with a lot more crime, a lot more people dying of heart attacks in their living room, that kind of thing statewide.
Well, I think, the only thing is they already took him to court and lost.
Yeah, but reasonably, if you look at the whole picture, there's going to be problems that.
Yeah, not denying it.
Seems like what Marnie has talked about here is pretty reasonable. Another question on the quick test antigen. I've taken those myself. I've read that those are often false positives on those, but do the vaccinated people have an opportunity to take those as well? Or is it just unvaccinated people?
Vaccinated employees can take those as well. Okay. And if we think we have a fault, like we'll see the bus driver today, she's feeling great, right? Can you imagine you go to work, you do a test, and then you get told you're positive, and you're like, you're kidding me, I feel fine. But we have a positive test. So she's going to connect with her medical provider. We can do a PCR, but the information we receive from the State Department of Health and even our local doctors is that the antigen quick tests usually are reliable for positives, not negatives, but we'll see. I guess I hope our experience proves out that way, because that's going to be super frustrating for us and our employees if they're false positives and we're sending them home and calling in someone else to cover class or drive a bus, or that's going to get old.
So one other question, if the people are working in schools where they don't have the same type of accommodation program or policy, does that work okay?
Yeah, actually, Steve, I'm glad you brought that up. I forgot to talk about that. So for all of our employees that are working out in school districts, we coordinated with superintendents in the schools where these employees work, and we are somewhat dependent on what they're doing in order to support our employees. So we did tell our employees, you need to wear a KN95 mask at all times. You need to test, but as the testing is directed and implemented in the district. So some districts, for example, Dayton School District is not implementing testing for unvaccinated employees. And I don't think they're strictly enforcing KN95 masks. If a district isn't implementing testing, we are not requiring our employees to test. At least thus far, we're not, because we'd have to figure out a way to, we can't be in Dayton and Goldendale and Ocean Beach. But what I will say is, so the districts that I know of for our employees that are doing something different than what we've asked, Dayton not testing, and they may be more lenient with masks. But I will also tell you that the vast majority of every one of these employees that we talked to were very committed to students, very concerned about safety, didn't express concerns about wearing a KN95. We have like 3 different samples. I'm wearing it, it's pretty comfortable. They wanted to, and some of them were already wearing that mask. So I think even in some of the districts where they're not, and we've sent them the KN95. So I think even say in Dayton, I think we have and will continue to have some of our staff that are wearing KN95s already. They don't want the kids to get sick. So that's a huge relief. In Goldendale, for example, I think they decided that they were going to use KN95s and not test because it was a bit too burdensome for them to implement. Ocean Beach is doing random testing of unvaccinated, so they're not doing it twice a week. Stevenson Carson's doing it twice a week and KN95s, and they're super strict about it. So we're aligning with our districts, but the majority of our districts are following these measures, and the ones that aren't following it for the KN95s, I think a lot of our employees are wearing them anyway.
Marty, the people who, like the lady in Longview, when she tested positive and she's unvaccinated and tested positive, did they get paid?
They do not get paid when they're not working, no. If they're sick and they have sick leave, they can use the sick leave. But if they're not sick, so for example, I got an email from an employee who was, telling me I had to miss 2.5 weeks of work because my family was sick with COVID and I wasn't sick. I felt fine, but you wouldn't let me come to work and I'm not vaccinated. If you're unvaccinated and non-symptomatic, you can work. So we have told employees who are not vaccinated and are not sick, but have to quarantine because they're not vaccinated, that they don't get paid. That's not popular. It doesn't happen a lot, but it has happened. So we have a few employees who are frustrated.
All they gotta do is just get a shot then.
Yeah.
Yep.
Well, I'm impressed with what you've come up with. I wish the whole state was working with the same rules because I think it's more realistic. It doesn't leave the community at great danger of, again, back to EMS, law enforcement, firefighters, etc. I think you've done a great job. Thank you.
Steve, did your firehouse lose some guys?
Well, I haven't checked. I know there were a number that early on were not getting vaccinated. By the way, I have 3 vaccinations. I'm not advocating one way or the other.
Me too.
But I know that there are statewide, there's quite a few.
Yeah.
And then like Port of Portland Fire Department, which is on Marine Drive, services the airport. They lost 16 firefighter and paramedics, which will definitely impact service to the airport. They provide EMS to the airport, which is like average 5 calls a day. TSA is like only 40% or 60% vaccinated. So there's going to be problems. That deadline is like November 22nd, right before Thanksgiving. So there's going to be a lot of issues. Anyway, I don't know if what you've done at ESD could apply to everybody, but sure seems realistic to me. And
Well, I think the statistics that Marnie gave, where we're at 91%, there's other, Vancouver School District, between their accommodations and their vaccination, our vaccination was 91, but I think Vancouver was at 94% and their whole staffing was around 99%. And that's running true to almost all our districts in the ESD. So very, very few people lost jobs because of that.
Yeah.
The one thing maybe we should, that's probably worth mentioning is the State Division of Children, Youth and Family Services issued a guideline the Tuesday, the 12th, when we had to have everyone comply by the 18th. And we'd already met with a few of our employees that work in the ESIP program. So Carol Hall's Birth to 3, Jeffrey can talk about this as well. Just that program, not ECAP, not Child Care Aware, but the ESIP program, they sent out guidelines and said, if you have an employee who needs an accommodation, they have to work 100% remotely. And we have 4 employees who have accommodations who have been and we're willing to follow safety measures. And when they go to meet with families, a lot of times families want in-person services and the kids do better with in-person services. We've had really strict safety protocols. The family has to fill out a health attestation, confirm no one's been sick, had symptoms, been in close contact. Our staff make sure that they're in that position. Everyone wears masks. If they get to the family home and there are more people there or someone's not wearing a mask, the staff leaves. So we feel pretty confident that we can do it safely. They practice 6 feet of physical distancing, but ESIT said no. So we have 4 employees who we're working with right now to see about our ability to adjust their work, but we're not going to have full-time work for 2 of those employees that's 100% virtual. So we may have a riff, or we've talked with Jeffrey about, because one's a teacher, so special ed teaching, one's an OT. We may be able, we've offered to help try to find them other jobs that they could do, but we may be forced to lose a couple of employees because of ESIT in the state, because they're taking that same hardline approach.
You know, I would say this too, our accommodations were kind of developed in conjunction with our health department and doctors down here. And, you know, we'll revisit those as case counts go down or go up. You know, it's not going to be a static thing. It'll change over time. And just can't say when.
Welcome to minimum wage. Okay, moving along, a superintendent's report. Tim, are you ready?
Yeah, I'm ready. First off, I just wanted to congratulate the board members who won their elections. We just got the results today, and you know, Wendy should have included them in the day packets. You know, to me, you know, we have 150 people who vote, but we only had like anywhere between 25 and 30 people vote. So that's got to be looked at the state level, I think. But our situation in 112 is not unique. I mean, it's the same everywhere else too. But anyway, congratulations. Glad you're all back. Next, I wanted to share just some COVID data and things that we talk about at the weekly meetings we have with superintendents and the Clark County health officials, Klickitat County health officials. Can you pull that up, Wendy? Yeah, go to the next slide. Okay. This is information that I get off the Seattle Times website, and it's, if you want to look at it, it changes every day. But you know, in the lower left-hand corner is a pie chart that says 59.9% of people in the state of Washington are vaccinated. And that includes all the people, over 7.6 million people. So 60% of the people are vaccinated. Then if you look in those boxes that we've Wendy coded, or those are the counties that we have. Clark County's at 54.6, Cowles is 51.7, Klickitat's at 42, Skamania is at 50.9, and you're the winner, 33.8 at Skamania. And it's almost the lowest one in the whole state of Washington. And Waukegan's at 47.8. So all our counties are below the statewide average. And the statewide average is as high as it is because if we look at King County, that's 70%. And that's, you know, over 2.5 million people live in King County out of that 7.6. So a third of the people live there. But it's significant because we are, in our region, one of the lower rated regions in the state. Go ahead and go to the next slide, Wendy. I guess I will back up just a sec. I want to mention that includes 0 to 12-year-olds. And Monique, you're on, right? Maybe not. I guess we're going to find out in a week. We found out today.
Sorry, Tim.
Yeah.
I was muted. Sorry, I'm on.
That's okay. You want to just mention what they said about what the FDA said about the shots for 5 to 12-year-olds?
Yeah, so the FDA, as of today, their smaller advisory committee met and they recommended the Pfizer shot for ages 5 to 11. The next step in the process is that there needs to be FDA approval for emergency use authorization for the FDA committee beyond the small group. And then after the FDA gives full approval, then the CDC will give approval for emergency use authorization. And it's possible that we could have students ages 5 or children ages 5 to 11 able to get vaccinations by the end of next week. Apparently, there's already doses in the supply chain. They've already been sent out in preparation for and in anticipation of the shot being approved by the FDA for emergency use authorization.
Thanks, Monique. So I think there's about 7% of our population is in that group, 7 to 8%. And, you know, so they'll become available or should become eligible within the next 2 weeks. And that should see numbers start popping up too. So go ahead, Wendy. A couple other charts that we look at. This is the hospitalization. And it's the percentage of beds that are occupied by COVID patients. And you can see in the last 2 months, because of the Delta variant, that we were at an all-time high in hospitalization for COVID patients, even back from the last summer. So go ahead, Wendy, next slide. This slide is about confirmed cases and how many cases we have daily. So you see, we were at our high point last winter between November and February, and just this last 2 months have been the highest we've ever been. And we're just starting to go down. This is the state of Washington. So we've had 716,000 cases. Next slide, Wendy. And the next slide is deaths in Washington. And so we peaked out in deaths too during this last rise too. And so we were up to 8,400 deaths now in the state. So this is the kind of data that we're looking at all the time at the superintendent level. Now, the thing that's been kind of frustrating for me was back in January of last year, as cases started to decline, we were getting a lot of hopeful comments about we're going to come back to school. We're going to, you know, then during the summer and late spring, they relaxed the masking for vaccinated folks. We're not hearing anything anymore about that, those issues. But, you know, so it's like we ask about, okay, what's next? What are you predicting? We're getting crickets back. And the governor quit talking about it. The doctors have quit talking about it. So I don't know if they're on a gag order or they just don't know, which is real possible. But, you know, I mean, we've got 60% of the state population vaccinated. You've got a lot of people who've been sick. When do you hit that magic number where, you know, this goes from being a pandemic and it's just endemic in our society? And then we have to learn how to live with it. And I'm supposing we're getting closer, but I've heard a lot of things too that, you know, our doctors are still worried about winter time's coming. We're going to be indoors and the constant reminders that we're getting. So we keep asking the questions. We're just not getting any answers.
You know, I read somewhere that in Oregon, September hospitalizations, 23% of the people that were hospitalized had been vaccinated, fully vaccinated.
Yeah.
But like last night, we watched the Seahawks, and there's like 80,000 people there, and nobody's wearing masks. So there's a lot of inconsistencies going on, I think.
There's no question. You know, Steve, they keep playing that way. They're not going to have to worry about COVID anymore at the Seahawks games. Yeah. This is the last slide that I want to show you. And this is the case counts. And this is really only for 10,000. So you have to multiply that by 10 to get the number that we are usually associated with. But if you look at like the counties like King County and San Juan County are both well over 70% vaccinated. they have the lowest rates. So it all correlates together. And our rates, Klickitat County is at almost 700 per 100,000 cases per 100,000. Now, way back last year, we thought 200 was high. So Klickitat County is 3.5 times what we thought was high before. Skamania is almost at 500. Cowlitz is almost 450. Clark is at almost 400. We just have not come down nearly as fast as a lot of these other places have rebounded. And there's no question that if more people were vaccinated, we'd be down there with Jefferson and King County. Those, but like I said, those are the highest vaccinated counties in the state. So any questions about that?
Not exactly a question, but Tim, I believe in your report, in our packet.
Yeah.
That it did say Klickitat and one other district had closed because the school.
Yeah, we've had Klickitat school closed for 3 days a couple weeks ago because they ran out of staff.
Oh.
And in Ocean Beach, they closed the high school. I believe it was for almost 10 days. And it was middle and high school because their sports teams were passing it around. And this was kids and staff. And so they kind of had to let it get out of the system. Because it was being.
Sorry.
Yeah, go ahead, Jeff.
Oh, no, just, and Dayton also had to close for 2 weeks, their middle and high school, because they had 3 staff members who also had children in the middle and high school. So the staff members and the children were all involved. And so they closed the middle school for 10 days to kind of get everything back to zero again.
And you know, Ann, I did hear too that in Trout Lake, they were at, I think they had 75 out of 190 kids were quarantined. Either because of close contacts, because of sports or relatives or whatever. I mean, you know, a lot of the small districts, the teachers are the parents of kids that go to school there. And so you have a lot of those connections and it's easy to fall into that quarantine category.
Tim, the Oakville was the same situation.
Yeah, I heard that, Dick. That's right. And then we've also had several school districts that just closed classrooms. I heard Kelso had a couple of classrooms that were closed. And really it's just to shut down the possibility of passing it on. And then in a lot of those school districts, they just end up going remote for a short period of time. But we're learning how to live with it. And it's kind of like Kevin was saying, he's got a remote program now, right? A hybrid program, and that's how we're living with it.
Well, have you heard that the seasonal flu is going around? Is that something too?
Yeah, it's there.
We're hypersensitive if you get a runny nose, but I mean, that's something that happens every year forever.
But it is causing a lot of the issues, Ann. I mean,
I know
the quarantine issues is just a runny nose. But yeah, I have heard from the pediatric group up in Cowlitz County that, yeah, the flu is around.
I think it was around our county for a little while anyway, it seems.
Yeah, I think you're finding a lot of kids that are sick, just getting sick in a normal way, colds, flu, but it's getting confused with COVID or, mixed with COVID.
Yeah.
So that's my COVID report. I wanted to, could you go to the next slide, Wendy? I want to talk about, and I did mention last board meeting that we are working on a couple proposals that we want to bring to the board in November that would impact employee pay and benefits in January of 22. And I mentioned the long-term care plan of the state. Now, they're requiring employees to enroll in long-term care, the state long-term care plan. And at the state level, it costs about 0.58% of a person's payroll for every month. And what we're wanting to do is use our health benefit pool that we had established a long time ago and run. When we left the healthcare authority and went on our own, we saved money. We've saved about $650,000. And the only way we can use that money is for employee benefits. And now that we're with the state program again, that money just is sitting in an account. And we're going to bring to the board, we'd like to be able to use that to pay for the employee, at least for this first 8 months during the 2022 year of this fiscal year. We think it's going to cost us about $200,000. And then going forward, what we'd like to do is kind of collapse that into our COLA increases going forward. So we would probably reduce the COLA a bit, and maybe the second year we'll only pick up half the cost. But like I said, the only thing we can use that money for is this type of thing. And now, since we're going to be on the state plans, we don't have anything else to use it for. And I think it's a good employee benefit for the staff. The second thing we're going to bring forward, I need to move my picture so I can read it, is to add a longevity step for 10 years. Now we've got on the salary schedules for classified, technical and supervisory, paraprofessional, and bus driver. We're trying to keep up with district pay schedules, and districts are negotiating salaries. When they had the big raises due to McCleary, but then they also usually tack on a certain percent of beyond that, and we're kind of falling behind in some areas. We also want to retain staff and reward longtime staff. So the cost for what I'm proposing is going to be like a 75-cent an hour adjustment and longevity step at 10 years. Be about $1,500 an employee, and cost for us for next year would be $95,000. We didn't budget for that, but it's something that we would like to bring forward to add in November to add in January for those 8 months. So I'm just kind of giving a pre-warning and just wondering if there are any questions about any of that. Okay.
Anyone?
Okay. Next up, Kathy, I want to have you mention, this is, we've been talking a lot about new programming that we've gotten because of this federal funds coming through OSPI. Well, we just got another notice of a new program, and SPI wrote the ESDs into it. I believe we were somewhat involved, but not really, more of a conversational involvement. And we did not know that this was coming, but we just found out the other day that ESDs are going to be part of a $14 million project. And it has to do with attendance and re-engagement of students, because the state has lost a lot of students. Our region's lost about 7% of our kids. So I want Kathy to talk a little bit about this program. And we were considered was one of the leaders in this area anyway, because of our truancy program, because we don't do it the same in the state as everyone else. We kind of go the ESD 112 extra mile on that. So Kathy.
Yeah, thank you, Tim. So Chrissy Johnson is one of the program managers at OSPI, and her focus is on attendance. We've partnered with her a lot in the past. She's partnered with Deb Drandoff a lot, and we've worked on Kaiser grants and things like that. But the proposal she submitted was around attendance and re-engagement. So it's really how do we find kids that have been disengaged through the pandemic? So those could be missing students that are no longer enrolled, students that continue to have high level of absences, students that might have lower grades or lots of incompletes and no credits. And so that's really kind of the problem that she was hoping to solve. So what she's wanting to do is to create like a tiered system in each ESD. So when Tim just mentioned we have a truancy project, that's kind of more of a tier 3 intervention, right? Those are a small number of students who get this kind of support, and it's kind of, in concert with the courts. But what she's hoping is each ESD could also have a tier 1 system, which would really be working with districts to help them identify the strategies they currently have to support students in successful attendance, providing training, things like that. She also wants to, they would be a process to identify like around 3 to 5 districts per ESD that would also get staffing. So if they needed additional staffing to help as like a graduation coach or a mentor or to find students, so to really help them with those re-engagement efforts. And then for the tier 3, which is the model that we have, is how could other ESDs kind of replicate that model or a model like that? So that was kind of pointed to as the sustainability. So there's still some conversations happening, and I know that Tim's has conversations too with the other superintendents about what it might look like in each ESD. If you know, I feel like we are well poised to have the whole entire 3-tiered system and to work with OSPI kind of as they have thought of it in their head and the districts that are selected. But I know that other ESDs, it might look different, or they might not have all 3 of those tiers. But I'm really excited to see what happens next with the program and to see how they might identify districts, especially since coming out of a pandemic, what kind of data they're going to use to identify those districts that are in need.
Yeah, so I think, you know, the funding for ESDs out of that money, I believe, is like 300,000 per ESD, but it may not all play out that way. We aren't sure how many ESDs are up to doing this work. We're ready to go and take on more FTE and to help other areas. But I'm going to meet on Thursday with the superintendents, and you know, once they get past the pick your chin up off the floor because it's more work and we didn't know about it, then we'll figure out how we're going to deploy in the state.
Tim, can I add one thing?
Yeah, you bet.
So they've kind of identified this 3-tiered system, but what another cool thing that another unique thing that we have in our region is kind of some tier 4 supports. So we have our Spiro program, which is really a way to try to engage students that have, you know, the anxiety for coming back to school. So we already have something here that for students that are more at need, that we would be able to refer them to, as well as embedded mental health therapists, you know, in our building. So I think it really kind of rounds out some of the great supports we already have, and yeah, it'll be an interesting project.
And Kathy, also, you know, in the build out of the 2,400 building, we're going to build a basic ed mental health side too. That could be part of that too. I mean, we're going to have a place to refer kids to here on our own campus.
Tim or anyone, do you know how many other ESDs are actually engaged in this kind of thing?
Kathy probably knows better than I do, but.
So we have one of the ESDs already has a pretty good tier 1 system where they have Java-like folks come together, you know, kind of a format that we already have with other roles in districts, but we don't currently have one. They also do a lot of training, like attendance work type trainings and things like that. And then we of course have the Truancy Project, which is completely different than it is in any other ESD. And so we have that piece. And then ESD 105 does a couple of interesting things too with a small group of districts. So 3 of us have like little parts. So hopefully we get to put them all together.
Yeah, we're looking to build out the first 2 steps.
Mm-hmm.
That's amazing.
And others will be trying to build out step 2 and 3. And
then we'll make this lovely roadmap everybody can follow.
Yeah, that's right. That's the goal.
And that might be a great topic for AESA's annual convention.
Yeah, you could be right on that too.
Are there any comments or questions from the board or attendees? Okay, we're going to move ahead.
Hey, I got a couple other things, okay?
Oh, so sorry.
Yeah, no worries. Hey, just wanted to have Gavin give a facility and property update and also a PPE update.
So on the property side, we got several things still going on. The biggest item is the sale of the 2300 warehouse and the currently warehouse occupied by Church and Dwight. So the work that's been going on from the buyer and with us in regards to the short plat has been delivered to the city. The city's been involved through that process. So the expectation is that there's going to be approval granted in the next, I would say the next 3 to 4 weeks. At least that's the hope. We have the agreement, the sale agreement has the period of time for the sale to go through December end year, December 31st. But hopefully we will be able to close sooner than that. So right now, I think we're looking at, I'd say maybe a little optimistic, but I'd say by early December to be able to finally close on the property. So that's a real positive thing.
Hey, Gavin, what kind of when does the board actually approve that? I mean, would it be at the December 14 board meeting, or like, it wouldn't be in November, would it? I mean,
the sale agreement is already approved, but what we will be bringing back in the November meeting is any approvals on the refinancing package. That's the next step. Waiting to get capital. We have it financed through Capital One. Capital One was having us do basically allowing the proceeds to pay off because we have 2 notes on the property. One of them is the private side of it, but we also want the proceeds to come in and also pay down the ESD occupied space with that. And that likely is going to require some financing adjustments to our existing note. So that would happen in November. If it's not officially required then in November, but we will definitely be able to come back with an update or with the request of what that resolution would look like.
Okay.
So that's in place. We've third time work this time with the mental health, behavioral health center. Went out to bid, closed. That bid process is closed. We're finalizing the contract with a construction company, a general contractor, Christensen Incorporated. They're out of Tumwater. The bid price was $2.36 million. We have 1.96 million was awarded to the Department of Commerce grant. So that's the real good news is very high percentage of that project is going to be funded under the grant. The expected, very likely we're expecting work to start next week. As far as at least them mobilizing, that's how close we are. We're just really waiting on our architects to finalize a few last minute things as far as on the drawings. But that price at 2.36 million is over $1 million lower than what our low was in the last round. And I think we had five general contractors that bid this time, and that were within $200,000 of that price. So we had a lot of participation. We made some adjustments. The main adjustment we did was we changed the naming of the project. I mean, because we talked about it being a behavioral mental health center. This time we didn't change the drawings, didn't change anything, but by taking out the mental health center part and talking about from a warehouse conversion to office space and multi-purpose space, that also got us different contractors that came to the table. So really happy with the result there. Christensen is a reputable contractor, and I expect things will go well and the project completion time is 4 to 6 months. The transportation center, we're just finishing that up. We're on finish work right now. Drop ceilings being completed. And and then carpet goes in, and then it will be complete. In that transportation center is what we're talking about is the remodel where we added in a training room and an office and some storage space out there. And 75% of that project was done in-house by our facilities team. And the next project that we have that we're working with the design and engineering, just getting that going. That's the 49th Street Academy building that we're converting to an early learning space, and have a commitment from Evergreen on a long-term lease of that facility. So any questions about any of those projects?
Gavin, nice work on the 2400 building, getting that budget back in line.
No, that has been a long road too.
Yeah, they're all long roads.
Yeah, COVID has definitely complicated anything to do with, CSG. Our team of CSG is amazing because how they're getting these schools completed and at a high quality is during this time is pretty amazing.
So Gavin, how about the PPE? Yeah, real quick.
Just real quick, the PPE, we're having lots of fun with shippers and the logistical side of PPE. The stuff you're seeing on the news and reading about as far as supply issues everywhere, we're experiencing it firsthand with this. It's really crazy. You can't really count on anything until it actually shows up, and just sort of expect the worst and work through it. The good news is we've been able to we've been utilizing our full list of awarded suppliers and breaking up orders and everything else so we could get at least a supply that keeps schools going. So we've been successful at that. We've received almost 3 million masks in the last 3-4 days. But it's trickling in of what we need to keep things going. We have our order for this round. We have we're delivering 8 million of the youth and adult 3-ply masks to schools, 500,000 of the KN95, and 40,000 boxes of gloves. And the one thing that's we've got this if we could just get the supply coming in very readily, we could get this, we'd be doing really well. We're down to really, we have between 3 to 4 of us that are working on this project. So it's a lot smaller than we originally had it set up, but we're still pushing a lot of volume through in a short amount of time. Like the example is this week, we're going to every ESD this week, region. And so that's
but you're dropping off at ESDs, right, Gavin?
The smaller orders we're dropping off at the ESDs, and the larger orders we're driven directly to the districts. Yep.
Yeah, this is a much smoother process, except for the supply line, than it was last summer, just because of we don't have as many items anymore. We're really focused in on masks and a couple other items. So Gavin, you guys are doing an awesome job. Just being able to keep districts, districts call Gavin directly or whatever they do, email our guys, and our guys have figured out how to get this done. So it's pretty incredible. But it also means we can never get out of the business. That makes it hard to get out.
We had our supplies floating off the California coast.
That's a lot of stuff is there, Ann.
Hopefully not the one that burned up though.
Yeah.
We got stuff sitting at Portland Airport that we can't get because they can't get a truck over here.
We do have one other quick thing is 2 days ago we launched over the weekend we launched the private schools. We're getting lots of requests from private schools that weren't participating. So we launched that this morning. We actually launched an online portal for them to order, and we're working with hubs across the state. And in the first 2 hours, we already had 26 orders from our private schools. So We expect that to get around a couple hundred by the end of the week, and we'll get that stuff out too. So that's another area that we've had to step in again on.
Where are the hubs, Gavin? Are they just at the ESDs or just Catholics or private school hubs?
Actually, the ESDs really aren't really playing a part in this at all. On this part, they're all the hubs are at other private schools around the state.
Okay.
So, but we've asked people to volunteer, and the private schools, I'd say we probably have like 30 private schools that have already stepped forward and said, we'll be a hub if you need us. So it's been good on that area.
Yeah, so we're learning a lot more. We're meeting a lot more people and building more partnerships, and who knows where those go. Dee, I'm done.
Okay, thank you. I kind of was a little premature there earlier. Okay, we're looking for employee acknowledgements and recognition. Monique?
Yes, thanks, Dee. And thank you in advance to Wendy for helping to run this PowerPoint. This is October's 2021 employee recognition. So Wendy, would you head to the next slide, please? And it's Wendy who we're recognizing. So Dr. Graham actually wrote in and recommended Wendy as getting a shout out and recognition. And I wholeheartedly agree. Wendy has always, when called, been willing to give help. This is the case for our other board members I talked to as well. When the ESD building was closed during COVID, Wendy was there every day. That to me goes beyond just loyalty. I have the feeling this is not just a job, but a source of pride. And so I would like to see her acknowledged. That's from Dr. Graham. So very lovely recognition for Wendy, who is-
Yeah, well deserved too.
Yes.
Yeah.
Steadfast in her support for ESD. All right, could you head to the next slide? Perfect. So this recognition is for Melissa Burt on my team. Melissa, among the many projects that she's done, including the flow charts that our school districts and school nurses rely on, in addition to the health department, Melissa also does bond and levy work, and she's getting back into that. She helped Klickitat School District with their levy flyer. And their superintendent, Brian Freeman, said, Melissa, this is really fantastic work. It's digestible and visually interesting. It's hard to capture the nuances and be clear. You did both. Thank you so much. And that gratitude extends to many of our other superintendents that Melissa has helped. She is truly a visual artist, able to cohesively share ideas and images through her design work.
Yeah, I think, Monique, it's pretty important to know, for the board to know too, she understands this stuff, how these tax rates affect people. And really, I even think she knows how to compute the tax rates. She's pretty awesome.
She is incredible. And we are just really fortunate to have Melissa, because not only does she care deeply, but you're right, Tim, she truly understands this stuff. And so she can help districts to explain things that maybe they didn't know how to explain before. So she's really incredible.
Yeah.
All right. This recognition is for Myra Najera. And Myra wrote a state-funded digital imaging grant to pay for scanning of insurance programs documents. And her application that she put together was one of 91 applicants, and one of the applicants that received a digital imaging grant up to $50,000, which is a huge accomplishment. So that's just really great work by Mike.
Hey, Marnie, can I ask you something about that? That was probably the first time she wrote a grant, isn't it?
Yeah.
It's pretty awesome what she did too, because I'm sure she had I know she didn't do it before, but and really being able to get it is an accomplishment. It's awesome.
Thank you. I'll be sure she knows.
Yeah, I already told her.
Really cool. And Myra's been awesome. We've worked with her a lot in communications. And so she's been our liaison. So she's been fantastic. And the Franklin Elementary childcare staff received some recognition. And this is from Woody Howard, principal at Franklin. I want to say thanks to your team at Franklin for their flexibility and the way they connect with students. I just walked by them and the students were happy and doing well. Thank you, Woody. So it's always nice to get some recognition from those within our districts for our childcare staff. And that should do it for employee recognition for this month.
Again, I want to personally thank Wendy and, thank Dr. Graham for, representing, a heartfelt thanks from himself that I think the rest of the board echoes as well.
And thank you, Dee and Dr. Graham. Appreciate it.
Mm-hmm. So we're looking to a proposal for action for the December 14th Board of Directors business meeting. Tim, do you want to lead the way?
Yeah, you bet. Our normal meeting in December is a lunch meeting. And we had decided last month we were going to be remote through the end of December. So what I'm really asking for is approval to move this meeting to 3 o'clock, just like a normal meeting, because it usually would start at 11:30.
Do you want a consensus or do you want it voted on?
I think we need to have a vote or a motion.
I move that we approve moving the December meeting until the 3 o'clock beginning time.
Second.
It's been moved and seconded to move the December 14, 2021 Board of Directors meeting from its holiday time of 11:30 to our standard 3 p.m. time. All those in favor, is there any debate? Excuse me. All those in favor of the motion indicate by saying aye.
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 Only heard 2.
I said it, but I'm farther away. So
Gotcha. Okay. All those opposed to the motion indicate by saying no. The ayes have it. The motion is adopted, and I'm sure Wendy will make sure that's taken care of in our calendar so we all don't show up at the wrong place at the wrong time.
Thanks, Dee.
Okay. This falls under public and board comments, and I'm going to read a brief statement here. And we have one visitor, external visitor by the name of John. And in this instance, the members of the pub, if there is a member of the public present on the call, and I need to read this statement. This item allows time for public comment, although this is not a time for discussion. The board appreciates and recognizes the value of public input. The board also recognizes that public comment may include constructive criticism, which the board welcomes, but public content that is directed to the board or staff that is abusive, irrelevant, inappropriate, or disruptive to the meeting will be interpreted and the speaker will be interpreted by me and the speaker removed permanently from the Zoom meeting. At this time, John, would you like to address the board? You are allowed 3 minutes for your statement. He may need to be unmuted. I'm not sure.
Dee, I guess it doesn't want to comment.
Having heard no response from our guest, John, we'd like to move on to correspondence. The correspondence file has been emailed to all board members for review. Is there any comment or discussion, questions with regard to the correspondence? Okay, having heard none. We'll move on to the upcoming board calendar, and it looks pretty full. Wendy, are there any upcoming dates that need a response from board members?
I don't think so, Dee. There is the WASDA Fall Regional Meeting that is tomorrow evening, and it's not too late to sign up for that if anybody else is interested. They did turn that into just a virtual event. They were going to have an in-person option, and they no longer have that. So it's a virtual meeting tomorrow evening.
Okay, I know I'm going to be traveling tomorrow, so I'm going to try and make that. Hopefully the connection will work.
Yeah, I'm going to attend. I think Mike is going to attend. Mark, I think you were going to attend too. Oh, Leanne was? Oh, sorry. Maybe it was Leanne, not Mark.
Okay, has anyone heard if the AESD, well, no, wait a minute, the AESA meeting in December, late November, December, will that be virtual or and have an option for virtual?
At this time, I believe it's in person, and they have not offered a virtual option.
Okay.
If that changes, we'll let the board
I don't
know.
think they're going to, Dee, because I think it's very difficult for them to do that. They said it was very expensive for some reason. I don't know why, but.
Okay. Okay. Is there any other business to come before the board?
If I could just mention, Connex is doing a trunk or treat this Friday. It'll be out in our parking lot. We've had the Hootenanny in the past, and last year we had a virtual event, but we'll have 22 trunks out there with staff members handing out candy to kids of all ages. And it begins, I believe, at 2:30 to 4:30. So if you're not doing anything, you want to come and see some kids of all ages dressed up in costumes, wear your own costume, come by Friday afternoon.
A good event. Yeah. Thanks, Mike.
Okay, having no further business to come before the board, I call this meeting adjourned at 4:41 p.m.
Thanks, Dee. Thanks, everyone.
Welcome. It's good to see everyone. Anne, you're looking terrific.
Oh, you see my hair?
I love it. I love it. No bad hair days.
It's the new rage, Ann.
Yes, thank you.
See you guys.
Everyone.
Have a lovely holiday.
Yeah, take care.
Halloween.
Bye-bye.